questions related to heart murmurs, along with explanations. 1. A 72-year-old man presents with syncope, chest pain, and dyspnea on exertion. A crescendo-decrescendo systolic murmur is heard at the right upper sternal border and radiates to the carotids. What is the most likely diagnosis? A. Mitral stenosis. B. Aortic stenosis. C. Aortic regurgitation. D. Tricuspid regurgitation. Correct answer, B. Aortic stenosis. Key features: crescendo-decrescendo systolic murmur, best heard at the right upper sternal border, radiates to the carotids, classic triad, syncope, angina, dyspnea. 2. A 65-year-old woman with a history of long-standing hypertension presents with a diastolic murmur heard best at the left sternal border. It is described as a blowing, high-pitched murmur that increases with expiration. What is the most likely diagnosis? A. Aortic regurgitation. B. Pulmonary regurgitation. C. Tricuspid stenosis. D. Mitral stenosis. Aortic regurgitation. Key features: early diastolic blowing murmur, best heard at the left sternal border, increases with expiration, left-sided murmurs, bounding pulses, widened pulse pressure. 3. A young woman presents with palpitations and chest pain. A mid-systolic click followed by a late systolic murmur is heard at the apex. The murmur increases with Valsalva maneuver. What is the most likely diagnosis? A. Aortic stenosis. B. Mitral valve prolapse. C. Hypertrophic cardiomyopathy. D. Ventricular septal defect. Correct answer B. Mitral valve prolapse, MVP. Key features: mid-systolic click, late systolic murmur, increases with Valsalva, decreased preload, associated with Marfan and Ehlers-Danlos syndrome. 4. A 40-year-old man with a history of IV drug use presents with a holosystolic murmur best heard at the left lower sternal border, which increases with inspiration. What is the most likely diagnosis? A. Aortic stenosis. B. Mitral regurgitation. C. Tricuspid regurgitation. D. Ventricular septal defect. Correct answer: tricuspid regurgitation. Key features: holosystolic murmur, best heard at the left lower sternal border, increases with inspiration, right-sided murmur sign, associated with IV drug use, infective endocarditis. 5. A 5-year-old child has a continuous machine-like murmur, best heard at the left infraclavicular area. What is the most likely diagnosis? A. Atrial septal defect. B. Patent ductus arteriosus. C. Ventricular septal defect. D. Coarctation of the aorta. Correct answer, B. Patent ductus arteriosus. Key features: continuous, machine-like murmur, best heard at the left infraclavicular area, common in preterm infants. Treatment: indomethacin to close PDA. 6. A 55-year-old woman with a history of rheumatic fever presents with exertional dyspnea and hemoptysis. A low-pitched, rumbling diastolic murmur with an opening snap is heard at the apex. What is the most likely diagnosis? A. Aortic stenosis. B. Mitral stenosis. C. Tricuspid stenosis. D. Pulmonary stenosis. Correct answer B. Mitral stenosis. Key features: low-pitched, diastolic rumbling murmur, opening snap due to stiff mitral valve, best heard at the apex, common cause rheumatic fever. 7. A young athlete suddenly collapses during a basketball game. On exam, a harsh systolic murmur is heard at the left lower sternal border and increases with Valsalva. What is the most likely diagnosis? A. Aortic stenosis. B. Hypertrophic cardiomyopathy. C. Mitral valve prolapse. D. Ventricular septal defect. Correct answer, B. Hypertrophic cardiomyopathy, HCM. Key features: harsh systolic murmur at left sternal border, increases with Valsalva, decreased preload, young athlete with sudden cardiac death risk, autosomal dominant mutation in BEPA myosin heavy chain. 8. A 3-year-old child presents with a widely split fixed S2 and a systolic murmur at the upper left sternal border. What is the most likely diagnosis? A. Atrial septal defect. B. Ventricular septal defect. C. Patent ductus arteriosus. D. Tetralogy of Fallot. Correct answer: atrial septal defect, AC. Key features: widely split fixed S2, systolic murmur at the upper left sternal border, common in Down syndrome ostium primum ASD. 9. A newborn presents with cyanosis, boot-shaped heart on CXR, and a harsh systolic murmur, What is the most likely diagnosis? A. Tetralogy of Fallot. B. Transposition of the great vessels truncus arteriosus. D. Total anomalous pulmonary venous return. Correct answer A. Tetralogy of Fallot. Key features: cyanosis, boot-shaped heart on CXR, harsh systolic murmur, TET spells, cyanosis relieved by squatting. NASHA 10. A newborn is diagnosed with a congenital heart defect. A continuous murmur that is best heard at the infraclavicular area is detected. Indomethacin is administered. What is the underlying condition? A. Coarctation of the aorta. B. Patent ductus arteriosus. C. Aortic stenosis. D. Pulmonary stenosis. Correct answer B. Patent ductus arteriosus. Key features: continuous machine-like murmur, best heard at the left infraclavicular area. Treatment: indomethacin, closes PDA. Would you like a table summarizing heart